99 Queen Street West, this is Toronto's breaking news, CP24. Good afternoon, I'm Kayla Williams. A protest took place outside a long-term care home in the city's East End today. Families of residents at Tender Care Living Centre are demanding answers about the COVID-19 outbreak at the facility. 43 residents have died of COVID-19 and 107 resident cases are still active. 77 staff have caught the virus, 43 staff cases are still active, and 9 have returned to work. Tests on staff as well as residents are being conducted every 3 days. North York General Hospital is now managing the facility.
Nothing has changed from the first round. We had ample warning of this. The question truly on everybody's mind is, where is Dr. Fullerton, who's supposed to be the minister in charge of this? Why isn't she here? Why isn't the ministry pulling out all the stops to help people? People are dying. This is a calamity. This is a crisis, and some say even a crime. I mean, again, there was ample knowledge. What is the management doing? Who's liable? Truly, this is a disaster, and we don't see the kind of response that we should be getting in a disaster.
And Jessica Wong, whose grandmother is a resident at Tender Care, says more workers are needed to help care for those living there.
They are still in need of staff. They are still in need of nurses, especially. We still need help to get residents their basic care. So even things like eating, feeding the residents. I mean, even before this outbreak, there were residents in there that were having a hard time eating. And even more so now, they're tired and weak and they cannot feed themselves. So we need people in there to help them eat so they can stay hydrated.
NDP leader Andrea Horwath is calling on the Premier to urgently replace Merrilee Fullerton as long-term care minister. CP24's Lena Latifat joins us live now with more on this situation in long-term care across the province. Lena, good afternoon.
Good afternoon, Kayla. The stories we have been hearing have been gut-wrenching. More and more families in Ontario are pleading for help as the situation at long-term care homes worsens. So what is the Ford government doing about this, and what needs to change? Joining me now to talk all about this is long-term care minister Merrilee Fullerton. Minister, thank you so much for your time, and thanks for being with us this afternoon. It's good to hear from you.
You're very welcome, and I'll start by just giving my condolences to everyone who's lost a loved one, a friend who's been impacted by this terrible, terrible virus, and let them know that we are doing everything, using every measure and every tool, and this is substantially different from wave one, and we will continue to use every measure possible. And I'm happy to answer any questions.
Right. Your office has been issuing some statements, but you haven't been facing the cameras recently. You haven't been taking questions from reporters. This at a time when so many families, Minister, are living in fear. They are losing their loved ones, their parents, their grandparents every day, yet you haven't been making yourself available. Why is that? Where have you been?
Well, I'll push back on that and say that I have been making myself available. Of course, we are working 24 hours, 7 days a week to support our long-term care homes. This requires a coordinated effort amongst many groups, and I'm incredibly grateful to everyone who is working, whether it's the public health units who come in immediately on the first case, and this is something that we changed very early in wave one to make sure that the public health units were into the homes as quickly as possible. We've partnered our long-term care homes with a hospital partner, and so that can be a quick response. We've put money behind all the measures, whether it's the infection prevention and control, and all the tools that we've been using so far. And wave two is substantially different. Our staffing is holding. Of course, I've been quite clear about the staffing crisis that pre-existed COVID, and now how quickly our new ministry was working to address that after many, many years of neglect. And the Specialized Care Centre is the next tool, which we've been working very hard to put into place.
Right. I know about that specialized center. We'll get to that in a moment, but there was a protest at Tender Care Living Center in Scarborough. That is a home that is hard hit by this virus. This wasn't the first rally there. The death toll there now sits at 43. Hundreds more infected. More than 100 residents there have contracted COVID-19 as well. We know North York General Hospital has finally taken control of that home. It took a while to get there, but we're still hearing of staffing shortages. More nurses are needed there. I want to ask you, why not call on the military for assistance? Why not ask for that help?
Well, we're listening to the leadership position of the North York General Hospital, and I should also clarify, they have been there for a while, even before we created the voluntary management contract. Scarborough Health Network was helping before that, and so there has been an ongoing concerted effort to shore up this home right from the beginning, and that's so important to get in and respond quickly. The nature of this virus and the testing that we're doing, as you mentioned, multiple times a week now, has really been helping with the surveillance testing, making sure that cases don't get in, but it only takes one case.
Right.
And this is why it's so incredibly important that everyone do their part in the community to follow the public health guidelines. But the home is stable. It is needing, it's good with personal support worker. It has sufficient numbers of personal support workers. Its physician supply is strong. We do have an outreach for nurses, and the North York General Hospital is doing that on an ongoing basis. This is something that as staff resolve, they will be able to return to the home. And this is why it's so incredibly important that we get the communication out to families. And often what we see in homes that go into outbreak, and it happens very quickly, and they can have numerous cases very quickly. And so the staff then focuses on the residents, and the communication starts to lag. But we have required all homes to have a communication plan in the works to be prepared for something like this. But still, that is why the North York General Hospital is assisting. They have a dedicated person who is responsible for communicating to families and making sure that they know, because, you know, imagine putting yourself in the shoes of someone who's got a loved one in a home like that. You would want to hear, you would want to know what was going on. But unfortunately, in some instances, no matter the plans, when it comes right down to it, you know, because these outbreaks are very, very severe in their impact, and they happen quickly. And that's why North York General Hospital is there now doing an outreach for communication, doing an outreach for human resources, and making sure that the nurses and the registered practical nurses, registered nurses, are shorn up. And we're getting that support to the home.
Right. I'm going to step in here because there was a physician that was at Tender Care Living Center for a few hours, and she said the situation was dire. From her perspective, she wouldn't agree with what you're saying. She says the military does need to be called in here, and we've also heard from other advocates who say the Red Cross should be called on as well. If you and the Premier ask the federal government for help, you will hear back. So why are you not asking for that help?
Well, in fact, we have reached out to the Canadian Red Cross, and that support had started long ago to make sure that we had the measures in place to make that request. And so that is also being done. We are not in the same situation as Wave 1. The staffing is holding. When we had our expert panel give us a report on the staffing back a number of months ago, it was very clear that there were other factors that led to the collapse of the staff in some homes. But we are getting the residents assessed through the physicians, making sure that the supports are there. And we, with the newest measure in the Specialized Care Center, the Toronto Grace Hospital Health Center is involved and will be prepared to take residents. The center is available since yesterday. And so if residents need to be transferred, if they need medical care, they will be transferred to hospital. If they need to be transferred to the Specialized Care Center, that's another option. And all these decisions are being made at the local level. They need to be made by the health experts and the so public health and the medical experts that are on site and associated with the hospital. The partners that we have on the ground. And it's exceedingly important that that expertise be respected. And it is there, and we are working with all our partners to make sure that that these homes get the support that they need. And I think for some physicians, it would be shocking to see the level of frailty in our long-term care homes if they haven't been into a long-term care home, and the level of care that our residents require. It really is very, very significant.
Right. You are saying all the right things here, but the numbers, they're telling a very different story. Currently, 194 homes in this province are dealing with an outbreak. We knew that the second wave was coming. You had months to prepare for this. You had all summer to prepare for this. So how do you justify being in this position today?
Well, yes, it's a terrible virus, and a lot of preparation has been ongoing since wave one. It was a continuous learning process. The world was learning about COVID-19. We put measures in place with very robust testing and surveillance to keep COVID out. You can see one case getting in, how devastating it can be, and it also speaks to the way that we've got public health involved right from the very first case. In many of our homes right now, about 90% of homes in Outbreak right now have no resident case. And that's because we made the definition of outbreak to mean even including one staff member self-isolating at home. And that was because we wanted to make sure that we could activate everything possible as quickly as possible. So public health, as soon as there's a case, it will be in to test. And the asymptomatic spread has posed an issue in wave one. We're much more cognizant of that now, and I think that's been accepted around the world, that it can spread without symptoms.
There have been calls for you. Oh, sorry, go ahead.
So when public health comes in, the next step is to engage the swabbing and get the tests done throughout the home. This is done en masse, and so typically the virus can be into the home without detection because of the asymptomatic spread, and somehow it gets in through the testing we were doing in the past, and it can spread. And so when we do the next round of testing, we might see a big jump. Some homes are managing to contain it, and others, by the time it is detected because of the asymptomatic nature of this virus, that means it spreads with no symptoms. It's much harder to find before it gets into the home.
Okay, I want to ask you, we're running out of time here, but there have been calls for you to step down. The leader of the opposition today asking for the premier to replace you. I won't ask you about that, but I will ask you this. Do you think you and your government have failed the elderly in Ontario?
I think society has failed the elderly. This long-term care sector was neglected for decades. I've been advocating all my career as a family doctor for seniors and the most vulnerable, and I'm bringing a scientific background to this, understanding not only the emotional part of it, but also the data and the science. And so I have been an advocate for reforming of long-term care for many years. I've studied it for 14 years, and I think society needs to be interested in what happens to its most vulnerable citizens. And I think we have to have a better balance of support for long-term care. Acute care is very necessary. When we have a car accident or a heart attack, you want acute care to be there. But we also need an understanding as a society of how important it is to treat our most vulnerable people in society with respect and dignity. And my government, our government, is the first in Canada to create a Minister of Long-Term Care. We are a brand new ministry. We have built it from scratch. And COVID hit when we were only a few months into this. So I am absolutely dedicated to our most vulnerable people. That's why I came to politics. My government is dedicated and committed to our most vulnerable people. And we need society to understand the imperative of supporting our not only our residents in long-term care, but also in the community as they age. We need a whole new rethink of long-term care. We need to understand how we keep people in their homes longer, how we support them into their most advanced ages, how the longevity will affect our abilities to support people longer and longer, and what we do about that. Long-term care is absolutely pivotal to a compassionate society, and we have a societal problem. Our government is dedicated to long-term care. I am dedicated to long-term care, and I'm bringing every ounce and every measure that I can to fight a deadly, deadly virus that has impacted our most vulnerable people. And we will continue to bring every measure and use every tool. And everyone has a role to play in this. Everyone can be part of this solution. So I would encourage everyone to spend their energy finding solutions and assisting. And I want to thank the essential caregivers that we have going into our homes to support their loved ones, whether it's just companionship, whether it's feeding, whether it's supporting the homes. And we have a societal problem that's been long-standing, and it's time that changed. Okay. And it's our government that is doing that. Thank you.
Minister, I want to also ask you about your colleague, the Finance Minister, Rod Phillips, taking a personal trip. We're learning here in this month, before the lockdown was announced, though, but this comes at a time when non-essential travel, of course, is not recommended for Canadians. What are your thoughts?
Well, you know, I'm not going to speak about someone else's life. I don't know the details of their life. I've been constantly working on the long-term care file ever since I started, and I will continue to do that. And I just hope that we can all pull together, do what is required under the public health rules. We can all bend this curve. We can help our long-term care homes get through this, and everyone can be part of the solution. Please follow the public health rules.
Okay. Long-term care Minister Merrilee Fullerton, thanks so much for your time, and we hope to have you on again to keep talking about the long-term care situation in Ontario.
Appreciate that. Thank you.
Thank you. And with that.